AfricanBio Medical Tests, we believe it is better to know early than to find out too late. Every year, more than 7 million babies are born in Nigeria. Most look perfectly healthy. They cry, they feed, they sleep. But some babies are carrying conditions no one can see yet. That is what newborn screening is for. It is a simple heel-prick blood test, usually done within the first 48 to 72 hours of life. It screens for serious conditions that are invisible at birth but can change a child's entire future if they are missed. Because at birth, many of these babies look completely fine. No obvious symptoms, no warning signs, nothing that tells the family or even the clinician that something dangerous has already begun. Newborn screening changes that. One test in the first days of life can change everything that follows. Take sickle cell disease. Nigeria has the highest burden in the world. More than 150,000 babies are born with sickle cell disease here every year. Without screening, the first painful crisis is often the first diagnosis. With screening, protection begins immediately. Families know, doctors know. Preventive care starts early. And these children have a much better chance to thrive. Congenital hypothyroidism is another example. It is one of the most common preventable causes of intellectual disability in the world. If it is caught in the first week of life, 1 tablet a day can correct it. If it is missed, the damage to brain development can be permanent. G6PD deficiency is also very common in Nigeria. About 1 in 4 males carries the gene. Without screening, the first exposure to certain drugs, foods, or infections can trigger a dangerous hemolytic crisis. But if it is identified at birth, it can be managed. Unknown, it becomes a hidden risk in that child's medical history. Galactosemia is rare, but when it is missed, it can become life-threatening very quickly. The baby may appear to feed normally while galactose builds up in the blood and begins damaging the liver, the brain, and the immune system. Detected early and managed with galactose-free nutrition, that same baby can go home and grow up normally. Congenital adrenal hyperplasia affects the hormones that regulate cortisol and salt balance. In severe cases, it can lead to sudden collapse within the first weeks of life. Screening gives clinicians the information they need before the crisis and before decisions are made without the full picture. PKU is also manageable when it is found early. A low phenylalanine diet, started in the first weeks of life, can prevent severe intellectual disability. The diet is the treatment. Screening is what makes that treatment possible in time. Beta thalassemia causes severe chronic anemia. Carriers are present across Nigeria, and early detection allows doctors to begin management, family education, and genetic counseling before the family is caught off guard by a transfusion-dependent future. Biotinidase deficiency is one of the most cost-effective conditions to treat in medicine. Early biotin supplementation can prevent the complications entirely. But if treatment does not start, the consequences can be severe and irreversible, and this is why the gap matters. Nigeria does not yet have a national newborn screening program. More than 95% of Nigerian babies receive no screening of any kind. In many countries, NBS is treated as a basic part of newborn care. Here, that gap is still costing families, clinicians, and children. AfricanBio Medical Tests exist to help close that gap. We make advanced newborn screening accessible in Nigeria by collecting dried blood spot samples locally, preserving them safely, and coordinating testing through trusted international partner laboratories using the same technologies behind leading newborn screening programs worldwide. For your facility, the process is simple. A heel prick at delivery, a dried blood spot on a filter card. Collection by our logistics team. With one dried blood spot, we can screen for up to 37 conditions, covering major metabolic, genetic, and hormonal disorders of clinical importance. We have also structured our pricing to make screening more accessible, with tiered panels from 45,000 naira to 80,000 naira and volume discounts of up to 20% for high-volume partner facilities. Onboarding takes less than a month. We handle training, kit supply, logistics, and digital reporting. Your team offers the test at delivery. We manage the rest. And when a positive result comes back, we support your team with confirmatory testing, specialist referral pathways, and a management plan before the family is left trying to figure it out alone. These are not just statistics, they are children, real Nigerian children who can have a different future because someone asked one simple question at delivery. The question is simple. The test is affordable. The impact can last a lifetime. We invite you as clinicians to make newborn screening routine. Your patients can access NBS directly through our digital platform, or you can refer them through us. Either way, the goal is the same: a screened child, a protected child, and a family that does not have to find out too late. Now, let us turn to a different kind of silent threat. Cancer is the second leading cause of death worldwide, and in Nigeria, too many people are still diagnosed late. Not because these cancers can never be found early, but because early testing is often not offered early enough. AMT is working to change that. We screen for 16 cancers, and with each one, the same principle holds. The earlier you find it, the more options the patient has. 16 cancers, one integrated molecular platform. Your patients do not have to wait until they have symptoms. And you do not have to wait either. Request a panel through our digital portal or contact us directly. Now let us talk about the tests that help keep well people well. Health and wellness testing is where medicine is going. And through AfricanBio Medical Tests, it is available in Nigeria now. These panels help identify risk early, guide appropriate interventions, and support patients before illness becomes a crisis. Cardiovascular risk testing is one example. An ECG shows what is happening today. Our molecular panel helps show what may be likely years from now, giving you time to intervene with lifestyle changes, medication, or specialist referral before the first major event. Mental health also has a biological layer. Genetic variants in serotonin and dopamine pathways can point to a predisposition toward anxiety, depression, or stress sensitivity. This does not replace clinical judgment, it supports it, giving you and your patient a clearer basis for early intervention. Nutritional genomics helps explain how a patient's body processes vitamins and nutrients at a genetic level. Food sensitivities are different from allergies. They can be delayed, IgG-mediated, and difficult to identify without testing. Our panel covers more than 200 foods, giving patients a clearer elimination guide instead of years of guessing. Obesity is not simply a willpower issue. Genes such as FTO, MC4R, and other metabolic markers can help explain why some patients struggle even when they are trying. Our panel helps show what their body may need to respond. Reproductive health testing looks at both partners. Sperm DNA fragmentation, anti-Mullerian hormone levels, PCOS markers, carrier screening for inherited conditions. Wellness testing is medicine at its most proactive. Your patients do not have to wait until something goes wrong. These panels give them and you the information to make every intervention count. AfricanBio Medical Tests also provides a full suite of relationship DNA testing for personal clarity, legal proceedings, and complex family questions that need scientific answers. All our DNA tests are conducted through our ISO accredited laboratory partners. Results are confidential, scientifically conclusive, and, where required, legally admissible. We handle the complexity, you refer the case. 4 pillars. Complete diagnostic support, from the newest life to the most complex family or clinical question. AfricanBio Medical Tests. To partner with us, order tests, or talk through how we can fit into your practice, contact us today. We will work around your workflow, not the other way around. Your patients deserve access to the best diagnostics Nigeria can offer. We are here to provide them. Partner with us. Add newborn screening to your delivery suite. Offer cancer panels in your oncology ward. Run wellness testing in your GP practice. The infrastructure is ready. So are we. Thank you for your time and for the work you do for your patients. We look forward to working with you.